Hi everyone, my name's Kirsti and I'm talking to you tonight about the Families and Children theme for the social plan. One of the most galvanising pieces of information that has led us to put this together is around the Australian Early Childhood Index. And what it shows is that the majority of our 5-year-olds in the Fraser Coast region are not developmentally ready to take their place in school. So let's have a look at what we've done. What we looked at were the strategies that we needed to, or that we felt were good to be able to improve the outcome of these children. We looked at, first of all, the fact that we needed some education for parents that improve their coping skills, their parenting skills, and their ability to bring their children along and make them ready for school. We looked at some early intervention and prevention strategies for families that need specific support. And we looked at providing cultural knowledge and awareness for Indigenous children who are in foster care. Some of our achievements to date include the fact that across our region we currently have 49 playgroups. This is a great achievement, and there are a lot of children who are in these playgroups who are actually learning and becoming more and more ready for school. However, we need to increase this, and we need to make sure that we run a range of diverse, culturally diverse and educationally diverse playgroups across our region. We have our First 5 Forever program that comes out to us through the Fraser Coast Libraries. And this is a program which encourages parents to be the first educator of their children and to work with them, particularly around literacy. We looked at early intervention, and there are a range of services across the region that provide early intervention activities for families who need them. What we need to do is to be able to pull those services together to make sure that people know exactly where to go and where to find what they need. We also have a wonderful perinatal health checking system, and that's run by the Department of Health. But again, that needs to be more greatly used than it currently is. So what are the opportunities that exist for us around this Families and Children theme? In relation to education, we might look at possible weekend playgroups. This would enable mums and dads to be able to come out and to be able to learn how to actively play with their children. And this is a little bit difficult for some of us. It's not easy to sit down and pretend that you are at a child's tea party, but these are the sorts of things that we need to do and actively encourage our parents to do. We could have some welcome baby celebrations where we as a community bring all of the families in. We can connect with each other, we can talk with each other, and we can actually welcome all of the babies that are born in our region and introduce them to our region. We can look at some adopted grandparent activities. These again enable older people in our community, and we have a lot of people in the Fraser Coast region that are in that demographic, and it allows them to come in and to interact with younger people. It's a very positive activity for the older generation because often they're not seeing their own grandchildren who don't necessarily live in this region. But it's also a wonderful opportunity for our younger people to learn from the older people in our community. In relation to early intervention, there are a number of things that we can do. One of them is around implementing a doula program. And this is where we provide a trained person, who can walk with the pregnant and then parenting families to help them as they try to overcome a range of different challenges that face a young family when they start out. We can look at outreach services that we can provide to young parents, and we have a number of models that we can go to across the country that give us a really good idea about how we might be able to put these together, and then we can work with our young people to make sure that what we're planning to do is something that suits them. We can look at integrating some early childhood educators with the current family support workers, and there have been a couple of programs across the country that have shown that this has had very positive results. And we can implement the First 1000 project across our community. And this is a project that concentrates on the first 5 years of a child's life and making sure that they pick up the things that they need to know and understand to take their place in the education sector. We can look at implementing the Brave Community Champions, and they will support expectant parents and families. And this again is a model that has been introduced in other places, that has shown some success and that we might tailor to be able to fit our community. And we certainly would look at reviewing the current perinatal health check and making sure that it provides all the opportunities that it needs to for our young people and our young families. In relation to the cultural knowledge for Indigenous children, we really need to start at the grassroots here. This is something that we don't have, and this is something that we need to connect with the community around. We need to listen to them, we need to understand their views and what they want to happen, and then we need to be able to cultivate the networks and the relationships across our region that would enable us to introduce something. And what we also need to do is have some action research around this. So when you're implementing a new program, it's generally not going to work perfectly the very first time. So we need to make sure that we're planning, we're implementing, but then we're evaluating and working with the community to make sure that we know that what we're doing is working before we then adapt our plan and move forward. So as you can see, there are a range of different things that we can do that will help the outcome for our children and families. And I look forward to talking to you in the future about the successes that we've had from that. Thanks.